Well, as we heard a moment ago, all three of Victoria's new coronavirus cases are linked to the Black Rock cluster, a sign, fingers crossed, the outbreak may already be under control. To talk more on this, I'm joined by Victorian opposition leader Michael O'Brien. Good afternoon to you, Michael.
Good afternoon, Julie. Good to be with you.
Michael, 3 locally acquired cases, as we've heard in Victoria today, 32,000 tests. What do you make of those figures?
Well, certainly any number of new cases in the low single digits is an indication that we're getting on top of this, that it's not spreading, that it's not a risk of becoming a third wave or a third lockdown, which is the last thing that Victorians can face. So, look, I think Victorians should take confidence from the numbers. The trouble is, of course, that thousands and thousands of Victorians who want to get tested, who've been told by the government to get tested, simply haven't been able to. They've been turned away from testing stations, or they've been waiting 6-7 hours. That's not acceptable. So I think that Victorians have responded magnificently to this latest challenge, but the government has really dropped the ball by not making sure the resources there at testing sites to get people through in a sensible timeframe.
So many people I've seen over the last couple of days that have been interviewed about this, as they're standing in the line or parked in their car, they're almost in tears because they are doing the right thing. They're doing what they've been instructed to do. How disappointing and how dangerous, more so, is this, that Victoria isn't on top of this at this moment in time?
Well, Julie, the Labor government here has had 9 months to get its act together. We've been through absolute hell in this state. We're the only state to have a second wave, a second harsh lockdown, curfews. You'd think with all that time the government could get the basics right when it comes to logistics at testing sites, but apparently not. So that's the most disappointing thing. Every person who's lined up for a test is there because the government has required them to do it, or because there's a reason why they believe they may be at risk. They've either been to a high-level exposure site or they've got symptoms. So Victorians are doing the right thing. And as I say, they have been let down by a government. Nobody should be turned away from a testing site, Julie. Nobody should have to wait 6 hours for a simple COVID test. So Victorians, big thumbs up. They've done the right thing, but the government has dropped the ball in a big way. And we just all hope that it doesn't lead to people who need to get tested saying it's all too hard. And if that leads to a further spread, that's going to be a real problem for Victoria. But the government needs to get on top of the logistics of the testing sites, give Victorians the confidence that they deserve, that if they turn up to get a test, they can get it done in a sensible period of time.
As you said, 9 months. Victoria endured such an horrific time. We now know thousands of nurses, midwives have been all called in to back up at these testing sites. Staff are working around the clock to do their bit. Really, should the state, is this such a surprise that the state government wasn't better prepared for another outbreak? COVID was never going to just go away overnight.
Well, look, Julie, you're right. And before Christmas, the government was saying there's a real risk with what's happening in New South Wales. And they were giving warnings to people who are in Sydney that you may want to think about coming home. So the government knew there was a prospect that there could be some COVID coming into Victoria. Why they didn't do the preparation, why they didn't have the people on standby, I don't know, but Victorians are entitled to know. And frankly, if you have to pay our healthcare workers more to bring them back from holiday, to make sure that those lines become something acceptable, to make sure that no one's turned away, pay them more. Because I can tell you what, as a Victorian, the cost to this state of our second lockdown is absolutely astronomical compared to the cost of paying healthcare workers a bit more to bring them back from their holidays and increasing resources at testing sites. It's a no-brainer.
Before I let you go, we just heard from our reporter that, more than 2,000 Victorian residents are currently stranded on the New South Wales border trying to get home. The borders were shut quite quickly. Acting New South Wales Premier John Barilaro said on radio this morning that borders aren't like a light switch. You can't turn them on and off again. Has Victoria been too quick to shut out the rest of the state? Has it been too quick to perhaps cause so much heartache and difficulty and just a very short amount of notice as well for all these people?
Look, Julia, I feel so sorry for those people, those Victorians who are holidaying in a green zone designated by the Victorian government, green zones in New South Wales, who are told at 4 o'clock on New Year's Eve, if you don't get back by midnight, you've got to isolate for 14 days. What if you were 9 hours away from the border and you only had 8 hours notice? What if you'd had a couple of drinks over lunch, over New Year's Eve, and you weren't in a state to drive back. I think a lot of Victorians who did the right thing were given next to no notice. It wasn't fair to them. And what should now happen is that given that the risk has been reduced both in Victoria and New South Wales, the Victorian government needs to work with those families that are stranded in New South Wales to get them back home as quickly and as safely as possible.
Victorian Opposition Leader Michael O'Brien, thank you so much for your time. We certainly appreciate it. Take care.
You too. Thanks, Julie.